sure we got audio going on here. No, what's been going on? We've had some issues lately. Yesterday I shouldn't have a good internet connection. Okay, so communication. Last little section here. That's the sharing of a thought, an idea, or a feeling. What are some, well, let's read this. It says involves a purposeful generation and transmission of a message of one person to one or more persons who can receive it, interpret it, and respond according to the intention of the message. So what does that mean? Kind of a wordy definition. Okay, so they understand it. You tell them something. What else? What does that say about communication in general? What is that definition of? How many people does it take? More than one, right? Okay. So definitely involves that. Because there has to be somebody who can receive it as well. I guess I can communicate with myself, but that would kind of I don't do that sometimes. Okay, so generation and transmission of a message by one person to someone else who can receive it, interpret it, and respond. So like Mallory said, they have to be able to understand it if you're going to actually communicate with them, right? So if I'm just using words, or if somebody sends me a letter in another language, okay, so they send me a letter and it's in Swahili. I don't know Swahili. I mean, I can pick out a few words, but you know, are they really communicating with me? No, I'm not going to get the message. I have no idea what they're telling me. I know Jumbo, that means hello, okay? That's not all I could, asante means thank you. And that's not all I would know. I know the first word and the last word, and that's it. So, yeah, it has to be, you know, there's two parts to that. So, good. So, different forms of communication. Reading, writing, listening, touching, and then seeing. We'll talk about all kinds of stuff. So. What are some other ways? What are some practical ways we communicate? Body language. All right. All right.
Speaking.
What?
Speaking.
What? I'm just kidding. So, yeah, speaking. We use our words. And so my child starts whining. I'm like, gotta use our words. I don't know what to do when you just whine and cry. We don't whine in my house. We do, but. What else? Well, how do y'all communicate?
Texting.
Texting. What'd you say? What'd you say?
Cell phones.
Oh, cell phones, yes. For sure. What y'all think of that mobile manners paper? Friday. Is that Friday? Did the mobile manners paper?
I don't know.
And it had all the stuff about the cell phone usage and all that. I think that was Friday. I was supposed to do that Friday. Were y'all here Friday? I'm sorry,
Yeah.
Oh, who knows?
Yeah, but the other class wasn't here.
Yeah. Okay. So texting, we use our cell phones all the time. What is one thing that cell phones and texting takes out that really we use a lot?
Body language.
Emotions, right? The emoticons, I mean, they're cute, but sometimes it's hard to find one that expresses what you think. Like, here's a prime example. Okay, so my husband sent me this text yesterday, and I'm not gonna read all of it, but he sent me all these pictures, and I don't know what they were supposed to mean because it was just like this weird face and then another weird face and then a teardrop face. I have no idea what they were. I think he was trying to get some kind of message across. I don't really know, but I couldn't find one that said confused, you know? So you can't just use emojis or whatever you want to call them. I tried to send a confused looking face, but it didn't look, I don't know, it just looked, I was like, I'm just really confused. That's what I said on the text back. But, you know, I mean, that definitely has some limitations. Have you ever gotten in an argument with somebody over something that you texted that maybe they took in a way that you didn't really mean, you know, because it's hard to put emotion into that, you know. Has anybody ever yelled at you over text message in all caps? Yeah. It's very offensive. Anyway. So yes, so forms of communication have changed a little over the years. Okay, so a couple different types. Everything pretty much fits into these two categories. We have verbal communication and nonverbal. So verbal can be spoken or written, basically just using words. So texting would fit into verbal communication, writing, you know, anything like that. Depends on the language for sure, right? You can read, you can do some nonverbal without language, but some. It says reveals things about the person, like their education, their culture, right? You can tell lots of things about someone according to how what words they use. Right? If I speak, so if I go to visit my family in Iowa, okay, and I go to a store, everybody knows I'm not from Iowa because of some of the things that I say and my accent. They're going to say you must be from Texas or somewhere south, right? Alabama accent's a little bit different, still southern, but a little bit different. So even from city to, you know, like whenever I went to school in Waco, everybody, you know, they're like, where are you from? I'm from Texas. And it gives you the ability to assess what people know or how they feel about something. You can ask them if they can use words, right? You can ask them if they know something. It's hard to know if somebody knows something by nonverbal. You know, I mean, sometimes I can tell if I ask a question and nobody in here has a clue. I can usually tell by nonverbal, but sometimes it's harder to. Okay, so nonverbal is what is not said. It's not verbalized. It doesn't use words. So it can include body language. Typically gives subtle meanings. Sometimes not so subtle. So yeah, there's some gestures that are not very subtle. But typically expresses the more true meaning. Okay, so if you ask me how I am today, and I'm like, I'm doing good. Look like Eeyore, you know. Are you going to believe me? What are you going to really think? Having a bad day, right? Even though I said I'm doing good, you know, but I'm like, you're going to read my body language. And that's what, for you, that's the true meaning. You know that, right? But if I'm like, I'm doing good, act like a crazy person, you're going to be like, okay, wow, she's really doing good today. I don't know what happened. So, yeah, typically it expresses the more true meaning. And we'll get into more specifics as far as communication goes next year. We get into lots of specifics in health science too. But okay, communication with coworkers. So we're talking specifically about healthcare. Definitely want to use medical terminology. Okay, we want to sound like we know what we're talking about. And we want to know what we're talking about, but we also want to sound like we know what we're talking about. So you definitely want to use medical terminology with other medical professionals or personnel, but you need to be able to quickly turn that on and off because you don't want to speak, you know, to a patient with using some of the medical terms that we learned in here. They're not being what you're talking about. So coordinate for effective care. So it's really important. Prime example, my sister had her surgery. You know, she had the nurse on the floor had not written down that she'd already had her medicine. They just didn't write down that they gave it to her. So when she got downstairs to the OR right before surgery, they tried to give her medicine again. She's like, no, I already had it, and that's not effective communication. They also realized they had the wrong chart on her bed, so someone else's chart info was on her bed. They were like, have you had a blood transfusion? She said, no. They said, well, your chart says you have. She was like, I have not had a blood transfusion. They looked, and it was the wrong person. So again, on the communication, you want, I don't know, it's so important in healthcare. I mean, that could have easily gone, if they didn't catch that, and what if that had been another, 28-year-old, she's not even 28, however old she was at the time, 26-year-old girl, they wouldn't have known that her name wasn't what it was unless they looked at her arm in. What if it was wrong too? And so what if they'd done the wrong surgery? That would have been not so great communication. Could have gone really bad. So it's definitely important that you coordinate for effective care. Everybody needs to know what's going on. Then discussions with supervisors and other team members need to be professional and respectful, all the things we talked about the other day. Okay, with patients, good communication is going to allow their needs to be met, right? They're going to feel like they can openly communicate with you, and you're going to feel like you can communicate with them. But that's what it allows. They're going to not, they're going to ask for things that they need, or if they're uncomfortable, they're going to be quicker to tell you. And they need to feel like that. You need to, they don't need to wait until their pain is unbearable before they tell you that they're having pain. Otherwise, it's hard to make it better. So they need to be able to trust you, which is the next one. Establishes a trusting relationship. The more you listen, the more you share info about what's going on, the more they're going to trust you and believe what you have to say and follow, instructions. So let's say you're the nurse and you go into a patient's room in the morning, tell them, okay, the doctor's supposed to come by later, we're going to do this, we're going to do that, whatever. And then you don't come back in for 4 or 5 hours, they're probably going to be aggravated when you come back in because they haven't had an update, they don't know what's going on. But even for that nurse, she had just stuck her head in every hour, a couple hours and said, I still haven't heard from the doctor, haven't gotten your lab results back, whatever it is, keeping them updated, that really builds a trust. And it just helps them to know what's going on. It's going to make them less edgy, and, they're going to want to do what you tell them to do. Patient education is so important, and it's important when and how you do that. But patient education is, before somebody leaves the hospital, they need to know what medicines are supposed to be taken. They need to know what kind of exercises they're supposed to be doing. They need to know exactly what care needs to look like at home. Can't tell you home health-wise how many times people get home from surgery or get home from the hospital and they don't remember a thing that anybody told them, don't know what medicines they're supposed to be on, they don't know. And because either somebody did their education, did their discharge teaching at a time when maybe they had a lot of medicine, maybe they were just really exhausted and so they couldn't pay attention. I mean, all that should be written down somewhere, it's important. And then, of course, working together. The more you communicate with them, the more they trust you, the more likely they are to work with you instead of against you and trying to get them, which works out well for everybody. Okay, barriers to communication. So if they're like overly medicated, or if they've just been medicated, maybe they have pain medicine. Okay, if you're trying to teach them how to care for a wound that they're going to go home with, 30 minutes after they've taken their pain medicine and they're so sleepy they can't keep their eyes open, probably not the best time to teach them about their wound care. So that's important that you time those activities in a way that's going to be effective for them. And I'm using nursing as an example a lot. I know that. That's just because that's my frame of reference. But okay, hearing or visual impairments can be communication barriers. They need to be able to understand you. Okay, do any of y'all have family members or grandparents who can't hear anything you say? Sometimes that can make it really difficult to communicate. I know doing home health, ran across lots of patients that had a really hard time hearing me, especially my voice is kind of high, and I don't talk real loud usually. And so I had to whenever I taught 7th grade science that year, they would laugh. They'd be like, Miss Bird, don't bring out your man voice, But sometimes I had to bring out the man voice when I was talking to home health patients because they couldn't hear me. So That's important that you can do that. I'm not saying you don't have to talk slow, okay? You don't say, Alex, take your medicine in the morning, okay? It doesn't have to be like that. You just need to make sure you say it loud and clear. You don't have to talk slow like you're talking to, your dog or something. Just loud and clear is usually plenty, is usually enough. Somebody who's deaf, okay, you can yell and scream at them, but it's not going to change the fact that they can't hear you, okay? Just because you talk, if they're truly deaf, okay, just because you talk louder, it's not going to make any difference. So, you need to either figure out an interpreter situation, write messages down, something like that. I used to have a patient that could not hear. She had some kind of disease that actually, or maybe she took a medication that actually, it caused hearing loss. Ototoxicity is what it's called. And so she always kept a little marker board and would write messages on there. She could speak, but I would write messages on there. And, I'd go into her house and her TV would be like ridiculously loud because she didn't know, But terminology, of course, again, if you use crazy terminology with patients, they're not going to know. If I'm saying, Valerie, your cephalalgia is caused by hypertension in your posterior parietal lobe and anterior to your carotid artery, blah, 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 okay? You're not going to know. Y'all might have an idea what some of those words mean, but if you're a patient, you're not going to know what that means. You just need to be really clear, but you need to be able to quickly go back and forth between lay terms and medical terms. You need to be able to say, yeah, your headache has to do with blood pressure in your carotid artery, and be able to say those kind of things. Language barriers, of course, again, it's so important. I cannot tell you how important it is that you don't guess when if you're trying to interpret. Now, if you speak a language fluently, then by all means translate. But if you don't, healthcare is not a place to guess and hope that you have right what someone says. Your doctor will make a diagnosis based on assessments. They're going to take their medicine according to whatever you tell them. And so you want to make sure that everything is very clear and that they can understand in their own language, what the instructions are. And so every hospital has translators. We use them all the time, especially at children's. We use translators all the time. And even at a family one time who was from Sudan, I think I talked about them before, but anyways, and we called we had like this phone company that would do translations. So put them on speakerphone. I would say it, they would translate over the phone, to the person in the same room, and then it would come back. So there's always something available. Speech impairments. You guys know, you probably know people who have speech impairments. Sometimes they can be really difficult to understand. So it's really important that you restate what you hear, that you don't just guess. If they say that they're not sure how to take their medicine, you restate it. So you're saying you're not sure how to take your medicine. That's a really good, restating is a really good therapeutic communication technique that helps you know that you've got the right message. Cultural differences, of course, there's some cultures where women, aren't supposed to talk to men, or men aren't supposed to talk to women, whatever. It's important that you know those cultural practices and that you follow them to the best of your ability within your practice. Now, there's going to be situations where you do have to do what's right beyond cultural issues, I would say, but 9 times out of 10, you follow as best you can the cultural issues. So if you have a patient, if you remember, who's having a really hard time because of the gender of the nurse or gender of the tech or whoever it is, then whoever's in charge needs to try to accommodate for that patient. And that's just part of customer service. That's part of, just getting along with people. And cultural issues, someone's culture is their culture. It's how they live. It's how they've grown up. It's, it's their norm. And so it's important to respect that within your abilities and what's safe for the patient. Okay, safety is always number one. Body language. So, if I go in and I'm asking the patient what's wrong with them, and I'm like, let's say they're like, oh, my stomach hurts, and I'm like, writing it down. So when did your stomach start hurting? What medicine did you take? When was the last time you pooped? Okay, do I seem very excited? No. Are they going to want to give me more than a one-word answer? Probably not. It's going to be really hard for me to get information from them. So I don't act interested. I don't act like I care. Just a little bit of acting like you care, okay, goes a really long way with people. Non-therapeutic communication skill, or I say skills, they're not really skills. Non-therapeutic communication barriers, I would say. Some of these include cliches, using cliches. So let's say somebody just gets a diagnosis of cancer and you're like, oh, it's going to be fine. You're going to be fine. Okay, well, there's two problems with that. One, that is just a cliche answer. That's like something anybody would say. And that really shuts them down because that says they didn't give me an individualized answer. They don't really care what's going on. Second problem with that is that maybe they're not going to be okay. You don't know. You're giving them false hope or false reassurance. And you don't want to do that either. The best thing to do in those kind of situations is listen and ask questions. Those are therapeutic communication skills. So tell me how that makes you feel. Or how do you feel about this? They say something sad, say go on, or tell me, do you want to talk about it? Tell me more. Those are things that can really encourage communication from them. You want to encourage open communication. So what are some ways we can avoid these barriers? How can we avoid some of these? What about the medicated patient?
Time things.
Yeah, timing-wise, right? Figure out a different time to go in. Okay, I know their medicine's due at 10. I probably need to go in and do my teaching at, 9 this morning or whatever it is. Or wait and do it at 11 or whatever their time period is. Hearing or visual impairments, just make sure you speak loud and clear. Okay, not loud and slow, but loud and clear. We already talked about terminology, language barriers, get a translator. Speech impairment, just make sure you're listening and trying to take in extra cues and do a lot of restating. Restate it back to them what you think you heard. All right, so nonverbal communication. And this typically expresses more of the meaning of the message than the verbal. Look, when we understand messages from people, only 7% comes from what we actually say. 38%, I would say that's probably more now, but only because of text. 38% is by the tone of the voice, right? If I say, I hate you, okay? Or if I'm like, I hate you, okay? Doesn't that give two very different messages? Definitely, okay? Hopefully you don't have to tell anyone that you hate them, but just as an example, that your tone of voice makes a big difference in it. Like the other day we were talking, somebody was like, shut up. And Hannah's like, you're not supposed to say shut up, And so for her, she doesn't really get yet that there's different meanings for things. But so that's important. And then, but 55% is by body language. So that's what really tells people that what's going on, Types of nonverbal, so gestures, using your hands, body language, how you're standing, your posture. And if I'm like this, again, what do we think? What does this tell you? I'm in class.
Tired.
I don't care. Maybe I'm sleepy.
Bored.
Miserable. Okay. Facial expressions. Say this is probably the most expressive type of communication. This is how we use our face. Lots of facial muscles. Eye contact. I can tell you a lot of things. Did y'all ever watch that show Lie to Me? It's older. It hasn't been on in a few years. Love the show, but that was one of the things he always did was he could tell if people were lying. course, this is just a show, but it's all this psychological stuff to tell people we're lying, like which direction their eyes turned, and if they were fidgeting or had their hand in their mouth, that meant one thing. Touch is another example of nonverbal communication. Verbal, again, spoken and written has to be clear. Avoid slang terms, right? So if I go, let me think, like at my grandparents, let's say I go to my grandparents' house, and like this happened one time. Let's say somebody's like, "Oh, that's bad," like they were talking about a new toy or something like that. Okay, and maybe my grandmother's like, "Oh no, what's bad?" Like doesn't know. That's kind of like a slang term that means we mean it to mean the opposite of what the actual word means, which makes no sense to me. But anyway, those are some examples. You don't want to do that in healthcare because you want people to make sure that they know what's going on and you don't want to confuse them. Avoid interruptions or distractions, especially when I did home health. I'd turn off the TV when I got there, right? Because it was like blaring loud and TV was going. They were not listening, whatever I had to say. And it's a therapeutic communication skill. So encourage them in a positive way. If they're talking or telling a story or telling something that's going on, encourage them. Oh yeah, go on. Like, tell me more. How did that make you feel? I see. What are your plans now? Or just some things that really communicate that they're free to openly talk and discuss. Listening is another therapeutic communication skill, and that's what a lot of times, even like I said earlier with the cancer diagnosis, you don't want to tell them you think, oh yeah, everything's going to be fine, because you don't know that. But you can't just listen, and that usually is what people really want. Even if they're just venting, they're upset about something, they just want somebody to give them the time of day to listen. Use terms that can be understood, and then allow the patient to speak. And that is that. I wanted to, there's one really interesting thing I wanted to go over for a second. Let me find it. I hadn't really thought about it.